How can I discuss reproductive health with my new CF doctor? Living with cystic fibrosis means managing many parts of your health, and talking about reproductive health is an important step in your journey. As you transition to adult care, your new doctor is there to support you in understanding how CF might affect your ability to have children, your sexual health, and your overall well-being. Remember, reproductive health is a normal part of adult life, and your care team is trained to handle these conversations with sensitivity and confidentiality. Start by recognizing that it's okay to bring up these topics. You might say, "I'd like to discuss how cystic fibrosis could impact my reproductive health," or ask specific questions about contraception, fertility, or pregnancy options. Preparing ahead can help you feel more confident. Think about what concerns you most, whether it's about birth control, fertility, or planning a family. Most females with cystic fibrosis start their periods around the same age as those without CF, but some may experience delays due to nutrition or overall health. If you notice irregular cycles or other concerns, your doctor can evaluate whether further testing is needed. For contraception, if you're sexually active and want to prevent pregnancy, options include hormonal methods, barrier methods, or intrauterine devices. However, some hormonal contraceptives containing estrogen may not be recommended for people with CF because of a slightly increased risk of blood clots. Your doctor can help you find a safe method that works with your medications and health status, especially since some antibiotics used in CF treatment can affect contraceptive effectiveness. Fertility can be different for each person with CF. Many women with CF can become pregnant, but they might experience thicker cervical mucus or irregular ovulation. For men, over 95% are infertile due to a condition called congenital bilateral absence of the vas deferens, which means they often cannot father biological children without assistance. Assisted reproductive technologies like in vitro fertilization or sperm retrieval can help some men with CF have children. If you're interested in having children, your doctor can refer you to specialists in reproductive endocrinology or urology for personalized advice. Pregnancy is possible for many women with CF, but it's considered high risk. It requires careful planning and close monitoring by both your CF care team and obstetricians experienced in high-risk pregnancies. Before trying to conceive, discuss your health, medications, and nutritional needs with your doctors. It's also important to do genetic carrier screening for you and your partner to understand the risk of passing CF to your child. Regular screenings like Pap tests and STI testing are essential for everyone, including people with CF, and the HPV vaccine is recommended to prevent cervical cancer. When talking with your doctor, be direct and open. You might say, "Can we discuss how CF might affect my fertility and options for family planning?" If you have specific concerns, ask whether seeing a reproductive specialist would be helpful. Review your medications together to understand which are safe during pregnancy and which might need adjustment. If you're considering having children and are worried about genetic risks, ask about carrier screening and genetic counseling. If treatments or medications could impact your fertility, discuss options like sperm or egg preservation before starting certain therapies or procedures. Don't forget to bring up sexual health concerns, such as comfort during intimacy or any difficulties you're experiencing. Your care team can provide practical advice, like using lubricants if dryness or irritation occurs, or adjusting positions if breathing issues make sex uncomfortable. Remember, as you move from pediatric to adult care, taking charge of your reproductive health is part of becoming an active participant in your overall well-being. These conversations help ensure your care plan aligns with your personal goals, whether that's preventing pregnancy, planning a family, or simply staying informed. Always keep in mind that your healthcare providers are there to support you with respect and confidentiality. Starting these conversations early and honestly can lead to better health outcomes and a greater sense of control over your life with cystic fibrosis. Your health journey is unique, and your team is ready to help you navigate it with confidence.